Are you a cash-based physical therapist and you think you're on the right track? But I'm here to tell you, there's 5 clinical mistakes that you're making as a cash-based physical therapist. And in this episode, I'm going to share why these are so important inside your clinical practice. Hi everyone, welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. Before I go into this podcast, what is new, what is exciting, what is better? I have a couple notes I wanted to share with you. Life is better. Someone asked, how is my back? They've been asking about this. I would say it's about 73.76% better. I still can't pull heavy from the ground, but I'm still getting in my 5 days, which has been fantastic. And someone asked, what was the root? Like what was the flare up? I think there was a combination of things. I think after the CrossFit Open in February and March, I think I just went into like training 6-7 days a week, right into Murph training. And that just kind of set off a cascade of things. It was just too much. The volume was too much. So here I am back to 5 days. So my back is feeling better, 76.27%. Life is good. Family's great. The latest with my kids is Jacob. For those of you who know, maybe I mentioned in the last podcast, but we are going on a Disney cruise in the next, I think, month or two. And one of the things that we're trying to get accomplished is my son Jacob. We're trying to get him to the point where he is fully potty trained, so that way he can enjoy this kids club. For those who don't know, Disney cruises have this kids club where they are just like, it's basically like a mini Disneyland. So excited for that. Other than that, I'm done with my 2-week cut, officially done. I ended up losing 9 pounds and I kept it up. I'm up, I think, 2.2 pounds. So I'm still down 7 pounds. So it's been great. And I'm excited. We have people registering for the Cash PT Clinical Elevation course. For those who don't know, it's my 8-week mentorship course on how to improve your practice, your clinical outcomes, and ultimately grow your business if you're a cash-based physical therapist. So anyways, those are the updates. Let's go on to this podcast. Why am I talking about the 5 clinical mistakes? So there's a portion of this I've had some really good discussions with local providers and people who are kind of stuck inside where they're at. And one of the conversations was the word cringy. Someone I mentor, told me, Chris, I had a cringy evaluation, a cringy sales call, a cringy session. I think we've all faced that in some form or fashion. You might not use that word, but you know that you felt internally like, gosh, that didn't go the way I wanted. And after kind of having that discussion of what is cringy, I wanted to bring up a couple things that you are doing that are probably cringeworthy, and you might not see it, but from an outsider perspective, somebody who's done this already for now 10 years and built a 3-location cash-based company, I can see what's cringy. And from an outsider perspective, either you can fix it, maybe you don't see it yet, but you can fix some of these things so that you feel better about your craft, you feel better about your outcomes, you feel better about your business development, and you don't go home thinking, gosh, that was horrible, I could have done a little bit better. And I think you can expedite that. So I'm going to share these 5 clinical mistakes that really are cringeworthy, that maybe in insurance-based care this would have worked, and now in cash it's just a little different. So here are the 5 things. One thing that you're making the biggest mistake on is you're targeting the words pain-free. Pain-free is very relative, and I've brought this up on numerous episodes that, do people actually feel that they're going to be pain-free in life? And I think that's really hard for people to really stomach, like even yourself or anybody that you treat, they don't want to be pain-free. Because pain is a normal part of life, right? You have some aches and pains. I have some back pain right now, but it doesn't interfere with my life enough to seek out care. And ultimately, that's where people want to thrive. They want to have this balance of they're okay with a little bit of aches and pains, but they're not fully pain-free, because that pain-free is so hard to achieve and it's momentary, right? So you can get somebody at 100%, but the minute they go back and they go for a run and now their calf is strained again, or they go for a deadlift and their back is a little tight, but it's not painful, it's just a little tight. And so one of the things when you target pain-free, you're setting yourself up for failure. And the reason is for that because people People don't expect that. But you as a clinician, because you've been taught and trained by PT school and traditional insurance-based model, is you have to get them to pain-free. They have to be 0 out of 10 or significant outcomes or significant improvements. And so because we've been trained that way, we now are trying to achieve that in a cash-based setting. And you're like, well, why does that matter? Well, the people in a cash-based setting don't necessarily need to be pain-free. They just want the quality of life that they've always wanted. And that quality of life is, it might be an ache, it might be a pain, but it doesn't interfere with their life. So all they want to do is enjoy life with less aches and pains, but they don't necessarily need pain-free. So if you're shoving pain-free down their throat, you're offering something that they don't want, and that's where the confusion lies. The consumer just wants an active, healthy lifestyle, and you're over here trying to offer pain-free services. There's very different things here, and so that nuance of pain-free, you need to remove that from your vocabulary, remove it from your website, remove it from your marketing, do anything that you're doing. Don't talk about it at the initial evaluation, because it's setting yourself for failure, because here's why. Let's assume you're 6 sessions in, and that patient is 70% better. That's pretty good. 70% over 6 visits is fantastic. And you're like, well, are you pain-free? Are you pain-free? And now in their head, they're like, well, I'm not pain-free. Maybe you're not doing that good of a job. And when in reality, what you should be asking is, are you happy with your progress? Are you in the direction? Are you doing more that you wanted? Are you living that active lifestyle? And they're probably going to say, yes, I'm actually like right back to it. So them, they're hitting certain markers that are successful for them. But what you're doing is you're asking a different route. Are you pain-free? No. Now they're not focusing on their function in life. They're now focusing on, well, gosh, I'm still in pain. And it puts their mindset in a different space. And so insurance, you had to do that, because you had to show that you were, you were the person who can remove their pain. You can remove all these impairments, and that led to pain-free. And that was just for ADLs. But people who are in cash-based physical therapy, they're not here for ADLs. They're here for higher level things. And so pain-free was good to ADLs, but no longer moving forward. So that's one thing that is cringy. It's cringe-worthy, and it's very. You can always tell you're in your first 3 to 5 years if you're still using those as a cash-based physical therapist, because you haven't figured that out yet. Now, if you're in your first, second year, you're ahead of the game. Now, after you're hearing this content, now you know, just implement it quickly, and it'll help. It's going to be tough for you, because it's the first thing you think about. Like, oh, we gotta get you pain-free, guys, get you pain-free, and you're setting yourself for failure. So remove that from your vocabulary. Number 2, you are impairment focused. And what I mean by this is you're always looking for the thing that's tight, that's loose, that's weak, that's strong, that's 3 out of 5, that's 4 out of 5, and they're very, very impairment focused. And as I mentioned, the cash pay patient is all about outcomes and about function. And this person just wants the active, the healthy lifestyle that they want. And you're over here trying to sell pain-free and impairments and tight hamstrings. We have to figure out, how does pain-free, tight hamstrings, weak hips, weak shoulders translate to an active, healthy lifestyle? That's where the dilemma is going. Now, you have somebody who is offering impairments, and the other one's looking for active lifestyle. That message doesn't match. And so you have the PT focusing on one thing and the patient wanting another thing. Now the expectations don't line up. So I think impairments are important to help direct your care internally, but it doesn't direct their plan. And that's a very different concept. In an insurance-based model, you've always used impairments as your plan. We're going to get you hamstrings 90 degrees in the next 6 weeks. We're going to get you ab strength 5 out of 5 in the next 8 weeks. So your impairments were your portions of your goals and your plans. Now, when you have a cash-based setting, these people aren't looking for impairments to solve their problems. They're just looking for a solution to their problem. So your plan has to be focused on function and percentages and where they're going to be in their gym. So now the impairments are good internally, but they're not good externally. So if you're going to approach impairments, that's fantastic for your own notes and documentation, your own internal progress, but don't translate that to what the consumer, what the patient wants. That's not what they're looking for. They're looking for, well, am I back to the gym 5 days a week? Am I able to squat? Am I able to deadlift? Those are 2 different things. So don't try and offer impairments as a solution to their plan. Differentiate those things. So number 1, don't focus on pain-free. Number 2, don't be impairment focused with the consumer, with the patient. That's not what they care about. Number 3, you're trying to compress an hour you're trying to, now that you maybe insurance-based, you had maybe 15 minutes or 30 minutes of one-on-one care, and now you have an hour. And so you think, well, gosh, I've never had an hour. So you try and fill that hour with all this treatment and rehab exercises. And you're like, you shorten your subjective, and you shorten your plan, and you shorten everything that you're going to do. And you try and get 55 minutes or 50 minutes of rehab and exercise because you think that's what the patient wants. You've never had that before. Here's the problem. That's what you've always wanted. That's not what the patient has wanted. This PT who's here now trying to deliver 50 minutes of care, they're just selfish. And what they're trying to do is they've never had that opportunity in insurance-based care. So now they have cash. Now they're like, oh my gosh, now I have more time to do hands-on treatment, have more rehab exercises. And by that time, you've overloaded the patient. Their body's all beat up. You've done so much manual work. You've over-adjusted them. And now you're doing 57 exercises. They're beat up. They're frustrated. They're tired. And no one actually listened to anything that they were actually wanting. You were just trying to fulfill your goal of being that sports, cash-based person, and you were doing all the cool exercises and speed and making them sweat. When in reality, maybe that person didn't want that. Maybe that's a specialty of yours, but ultimately, you didn't listen to them. The most important pieces of an entire cash-based setting is the subjective and the plan. And you have to have 5 to 10 minutes minimum on the subjective to, one, know how they're doing as a human before you go into, all the treatment. And on the back end is the plan of care and setting up what's the next week look like, what do the next 2 weeks look like. And so when you compress, when you do treatment and rehab all the way out and it fills up most of the time of the session, that person wasn't heard and they didn't get the thing that they wanted, which was a plan and execution of all this. You gave them a great hour, but they still don't know what to expect down the line. So that's natural in a cash-based setting early on because you're like, I've never had this, and you're now in a kid in a candy store and you get to all this time and you fail to realize you're not meeting demands of what the patient wanted. And you were so used to, because what the insurance company told you was you had a short amount of time. Now you have this freedom to do it, but that's not what the patient wants. That's not always what they want. And that's probably 80% of your caseload. And so if you're overloading people and you're trying to fill in with more exercise, that's not what you're trying to achieve. Leave more time for the subjective and the plan of care. So number one, no more targeting pain-free. Don't be impairment focused. And number three, don't try and fill an hour of treatment and rehab exercises. Number four, stop trying to help everyone. I had a great conversation with someone on my mentorship groups yesterday, and they said it's sad that we can't help. When we talk about orthopedic care and all the quality of care is dropping on all these things, the insurance base is no longer reimbursing at a certain rate. There's going to be all these patients who won't be able to get the quality of care that you want. And the reality is you can't help everyone. The reason why you got in cash physical therapy is because you wanted to have that one-on-one time. You wanted to specialize and not be the general Walmart approach and treat everyone. And because you enjoy creating outcomes for people who want it, the highly motivated, the highly active, there are people who want a better quality of life, and you just can't help everyone. And so you're scared to think about that, right? Because you got into healthcare because you wanted to help more people. And the reality is that the only way you help people are the ones who want to be helped by you using your specialized care. So get rid of the concept that you help everyone. It's very, very tough. It's not possible. Now you can help multiple age ranges, but you might have to specialize in certain groups or certain body parts or certain approaches, or maybe you're a McKenzie approach, you're a Maitland or a manual therapist, you're only rehab or whatever it is, or maybe you do personal training inside your sessions. Those are very specialized, but not everybody wants those things, and that's okay, but you just have to get very, very close and hone in on what makes you special. So number one, no targeting pain-free. Number two, don't be impairment focused. Number three, don't try and compress a full hour of rehab and treatment. You cannot help everyone. Figure out what makes you special and stick to that. And number five is you are probably not outlining clearly what the plan and expectations are. And the easy way to say that is you're not communicating properly. And it's very cringy to watch people. They fill an hour, they shorten down the subjective. They're like, yeah, I already know what I'm going to do for your low back. You go through the whole process, give them all the exercises, they're ready to go. And you really don't have a plan. You're like, okay, perfect. Let's see you next week. And let's see how you feel next week. Okay. That sounds great, Mary. And that patient didn't want any of that. What they wanted was somebody to just listen to them. They wanted to understand how long this is going to take, at what marker will they be 100%, when can they start running, when can they do this, when will they have the quality of life that they wanted. And what you wanted was, I want to solve your problem fast. But what you assumed was the back pain was the problem, and the problem is bigger than that. They have a problem inside their strength training regimen. They don't know what to do. They don't know all the form. And so while you're over here trying to mechanically fix the low back pain, that's not what they want. What they want is, how do I run better? How do I run more efficiently? I will have a marathon in 3 months. Is that possible? I'm scared. You need to be able to empathize with them, understand what their concerns are, so you can speak to that. That is what you're missing. And so when you go straight into designing your own plan of care, what you've failed to realize is that that person has a different plan of care that they want, and you have to listen to them and help direct that. And what you're doing is you're going straight to the dessert, and you're like, I just want to get treating, I want to get working. And what if that patient doesn't want manual work? Maybe they don't want rehab exercises, they just purely want a plan. And that's different. As an insurance-based provider, you come in and you're hungry to just treat, and what you fail to realize is the consumer is looking for something different, and it's not just the treatment. And so you have to identify that and ask, what are the main goals? What has worked for you in the past? What hasn't? What are you looking for specifically? How soon do you expect these results to get there? And once you outline these things, you know what their expectations are. You can speak to that in their plan of care. And those are the 5 things that you're doing that are creating clinical mistakes, and they're super cringy. And as a cash-based provider who mentors business owners like yourself, I can see it from afar. And if you're really trying to hone in on your clinical skills, your outcomes, grow your practice, and be that go-to expert inside your community, you got to get rid of these quickly. So if that's something you're passionate about and you want more mentorship on, I designed my Cash PT Clinical Elevation course specifically for people like you who are looking for, what do I need to do inside my sessions? What am I missing inside that I can get the customer in the door? I'm not getting the outcomes I want. I'm not getting the scenario I want. I can't create the plans. I'm going one-off treatment sessions, one by one. I just can't have continuity, and that's where you're lost. And the reality is, it has nothing to do with your clinical skills. It really has to do with your approach and how you structure and your system inside your clinical practice, and that's what I'm here to solve. And so if you are interested in that 8-week online mentorship course, you can go to drchrisgarcia.com/elevation and put yourself in a position where you're actually now going to thrive in your business, and you can have projection and forecast and be successful. So I'm excited to see you inside the course. If not, I'll see you guys on the next episode. Take care.